Okay, so I think we'll begin. Thank you so much, everyone, for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center. Before we begin, just wanted to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, feel free to visit our Blum Center website at massgeneral.org/Blum-Center. Please note everyone is in listen-only mode. Everyone has been muted so that we can hear our panelists today. If you have any questions for our panelists, please use the chat feature, which is located at the bottom of your screen. We'll have time for them. Only Blum Center staff and the panelists will see your questions. Please do not share any personal medical information or questions in the chat box. If you have any personal medical question, please ask your doctor. Okay. So next, I would like to introduce you all to our panelists. Today, we have Dr. Angie Sanchez. She is a physician scientist with family and community projections dedicated to the health, well-being, and advancement of communities. She is currently a research fellow of neurology at Harvard Medical School and the assistant director of the Community Access, Recruitment, and Engagement Research Center at Mass General Hospital. She dedicates time to investigate the science of community engagement to develop new strategies to improve access to research, healthcare services, and quality of life in vulnerable communities according to their individual needs. She has experience with vulnerable communities such as rural and low-income populations and expertise in conducting health promotion and disease prevention programs in hospitals and community health centers located in underserved neighborhoods of Columbia. We also have Dr. Marie Borgella. She has in-depth nursing experience, both as a bedside nurse and in nursing leadership. Borgella has served as a nurse manager and nurse director in academic medical centers, pediatric organizations, and community hospitals. She has led nursing teams specializing in pediatric neuroscience, general medicine, oncology, critical care, psychiatry, and substance disorder, all while working part-time or per diem at Mass General Hospital since 2002. At MGH, she served on the MGH Diversity Committee. Borgella's approach in nursing leadership is both innovative and evidence-based. Dr. Borgella holds a Bachelor of Science in Nursing from University of Massachusetts, Boston, a master's degree in business management and nursing leadership from Regis College, and doctorate in nursing practice from MGH Institute of Health Professions. In 2019, Borgella came home to MGH accepting a full-time position as nursing director of the brand new Bigelow 7 Medical Unit, where she built an entirely new team and collaborated with hospital leadership to successfully open this general medicine teaching unit. Borgella recently received a scholarship from the American Hospital Association's for the Next Generation Leaders Fellowship Program. Borgella's passion is in leading diversity inclusion initiatives and serving underserved communities. Her past volunteering services in the community include Rosie's Place, Believe in Success, which is an organization that works with survivors of domestic violence, Madison Park High School Board Advisory for Medical Assistant Program, all of which are located in Roxbury, Mass. Borgella was also a part of the Partners in Health Haiti Earthquake Deployment in 2010, Healing Hands for Haiti. Also, she was part of the Mass General Hospital Timothy Science Fair mentoring program. Currently, Borgella has been volunteering in Mattapan, Roxbury, and Chelsea, educating and supporting the community needs around vaccination efforts. Lastly, we have Dr. Efren Flores, currently serves as Officer for Radiology, Community Health, and Equity, and as a board-certified staff radiologist in thoracic and emergency radiology at Mass General Hospital. Dr. Flores is also an assistant professor in radiology at Harvard Medical School and is a faculty member of the Mongan Institute. Dr. Flores is a health services physician scientist focused on health equity, digital outreach, and advocacy. His research focuses on identifying social determinants of health impacting access to radiology among vulnerable communities and develop and implement programs to bridge the healthcare disparities gap. His current funded research projects focus on understanding and bridging lung cancer screening disparities faced by individuals from low socioeconomic backgrounds, Latino communities, and individuals with serious mental illness. Dr. Flores' research has led him to multiple peer-reviewed scientific publications and presentations at national meetings. Dr. Flores also serves on multiple local and national committees, including the MGH Executive Committee on Community Health, the American Cancer Association National Lung Cancer Roundtable, and the American College of Radiology Lung Cancer Screening 2.0 and Patient Family-Centered Care Communities, among others. So they join us today to give a discussion on how our community messengers have partnered with our underrepresented minority communities to build trust and provide education on the COVID-19 vaccine. So to start us off, we have Dr. Angie Sanchez. She is going to provide with some background information on how COVID-19 pandemic has affected our communities and some general information about the vaccine. So please join us and welcome Dr. Angie Sanchez.
Thank you, Amy, for the introduction. And again, thank you for to the Blum Center, to all the team that have been involved in all this effort, to Joe Betancourt team, Natalie, and that has been coordinating all the messaging, the van at Chelsea, Riviere, now that is Leslie also working in Dorchester to actually provide the best information to our communities. So to start, I just want to, I'm gonna share some slides just because it is easier for all of us. Can you see my screen? Perfect. It is easier for us to understand how the numbers, oh, sorry, one second, have been with the pandemic. But first, I believe that it is good to recognize the minorities that we are like working with or the community. So let's start by saying that Boston is a diverse city and we have a lot of minorities in Boston. So, and when I am talking about minorities, I am not talking about only about racial and ethnic minorities or groups. I am also including low income, low education and rural populations who have been like extremely affected by this pandemic. Why? Just because these people or these groups are more likely to be in overcrowded housing. They couldn't stop working. Most of them work in restaurants, supermarkets, housekeeping services, transportation, and they were just not able to stay at home or working from home. So they were more vulnerable to be infected, or actually are, because still the numbers are going up. Just as an example, and this is data from last year, from the Mauricio Gaston Institute, who is an institute that studies the Latino community in Massachusetts and in Boston. You can see that the 3 towns that were most affected in Massachusetts were Chelsea, Lawrence, Lynn, well, in Fourth Riviere. All of them are characterized for having a high number of Latino population within their town. Just at Chelsea, we have the Mass General Hospital has a community health center there. And we have, Chelsea has 64% of its population being identified as a Latino. And they have been extremely affected. As I said, Latinos mostly work with food preparation or restaurant, and they were not able to stop. That's why the level of, or the number of cases in this population have been extremely high. Just as an overview, this is just populations, and I'm going to focus just in the figure in the center, in the middle of this graph, where you can see all the groups or ethnic and racial groups that are identified by the Massachusetts Department of Public Health. And you can see how Hispanics or Latinos and Black population are the 2 groups most affected by the COVID-19 pandemic. Just because of all the reasons that I just talked about at the beginning that we're gonna be discussing among this presentation. And then we see Boston, we also can see that Black or African American communities and Latino and Hispanic community are the ones that are more vulnerable to have the disease or to present complications. And the numbers are like pretty similar when we see the number of deaths that I'm not showing in these slides. And then just by talking about the vaccine, we still have a lot of work to do, and that's probably is going to be our conversation. So there are different barriers that minority groups experience when accessing healthcare services, research, or in this case, vaccines. And I'm not gonna start talking about these barriers. This is gonna be another topic. But what it is important is just to keep in mind that doesn't matter all the efforts that we are like putting, still we see some disparities when classifying our population or by seeing demographics and who is accessing or not to the COVID-19 vaccine. You can see that Black, Hispanic communities are not receiving or are not fully vaccinated compared with our white folks. And that's why it is very important that all our effort, education activities remain in the community. Again, there are probably different reasons, not only barriers, but also organizational, administrative problems that, that reflect these numbers. But still, what it is important is just to keep in mind that it is that we as a messengers or as a community need to provide the best information for these communities, not only about the vaccine, but also talking about where to get the vaccine, all the sites that are usually available, helping them to make appointments, because probably there are like people that are low educated that don't know how to go through all the internet platform and get an appointment for the vaccine. So this was what I wanted to share first to open our conversation and just to put us all in the same page why all our community, especially our minorities, are being affected, and why it is very important that we continue communicating the vaccine and communicating all the information that is related to the COVID-19, because this is a population, those are populations that are particularly hit, and that they continue to be suffering for the consequences that the COVID-19 has brought.
Thank you so much, Dr. Sanchez. Dr. Borgella, Dr. Flores, do you have anything to add to that?
I think Dr. Sanchez pretty much wrap it up. I can talk a little bit about, again, thank you, Dr. Sanchez, for the background information on how COVID-19 pandemic has affected our communities, while also sharing some general information about the vaccine. You know, I think as community managers, we know for some people, facts, data, and the science will persuade them that getting vaccinated is the right choice and the right thing to do. But, you know, as Dr. Sanchez mentioned, you know, and we can share with you today, if we hope to succeed in getting the COVID-19 vaccine to the communities that have been disproportionately impacted by the virus, we as providers and healthcare clinicians need to, you know, to show up to rebuild, restore the trust in our broken medical systems and health interventions to these underserved communities. You know, one of the things that I know that we found as community messengers is the key to having productive conversations about the COVID-19 is in the community is real. It is trying to understand, you know, the community's concern while also acknowledging that their fears are real, and we don't dismiss them, but we listen. You know, like Dr. Sanchez mentioned, when it comes to the COVID-19 vaccines, it's not enough and only appropriate to just get the science right. The message we share matters, and so does the community messengers that are doing this work. We know that language and, you know, cultural barriers have made it difficult for many people of color, you know, immigrants and non-English speaking communities to get the COVID-19 vaccine. But, you know, I believe as community messengers, we are also competing with the fact that many immigrant communities have been bombarded with misinformation about COVID-19, seeing this information circulating about the vaccines, whether it's on the WhatsApps group, you know, Facebook and different social media are competing barriers for all of us to sort of get the important messaging through. You know, the other thing that I think Dr. Sanchez did an excellent job, you know, touching upon was giving more of the precedence based on age rather than the risk factors. But yet, for example, a typical living situation such as living in multi-generational home have put immigrant communities at a greater disadvantage. You know, I think in addition, as community messengers, we are constantly hearing false claims that, you know, the vaccines will alter people's DNA, you know, together with, you know, some anti-vaccine propaganda, and whether it's conspiracy theories, you know, I've even had the opportunity here, you know, can they contract HIV has been raised to me. You know, when people are hearing and seeing these misinformation constantly, it's barriers that just get in the way. You know, the other barrier too is that we've come to face is the tragic and dark events from the past that still remains deeply rooted in the consciousness of the Black and the minority communities. You know, I think as community messengers, we rely, as you know, as much as possible on our cultural competency and sensitivity to overcome some of these challenges. You know, the other aspect of our role is, you know, we found that the education and messages has to be presented by not only bilingually, but biculturally as well. You know, it's also important to message the vaccine and COVID-19 prevention well, and at the level that everyone understands and can relate to. It's definitely reassuring to know that as community messengers, we are able to build a culture, at least, you know, go full force on doing that, a culture of trust, because we are at that, you know, grassroots level. We are listening to people's concerns and understanding the origins of their hesitations. So I think, you know, being out there sort of embrace all of what Dr. Sanchez sort of shared with us.
I wanted to add to that just briefly to, you know, a couple of things both have said is just that for me, for example, as a radiologist, when I come to the hospital and I start interpreting, you know, examinations, seeing patients, and it breaks my heart to see still that a lot of the patients that are admitted to the hospital are underrepresented minority, a lot of Latino names that I see. We see imaging findings that are consistent with like COVID-19 on their chest x-rays or their CAT scans. And it really, we're 1 year later and still seeing this consistently. And I always ask myself, like, what can we do better to connect with our patients? You know, where are we missing that connection with our communities to deliver that message so we stop seeing this at some point? And that, as Angie put it earlier in the background information, it's a lot of social determinants that are impacting their care, and that result in multi-level barriers to them. And even though that we may have a vaccine or a lot of treatments against COVID, we don't have a lot of treatments against those social determinants of health. So it's up to us to really try to decrease the impact of them so patients can focus on their health, and we can focus on providing the best care possible for them. Then the other thing is that as in the process, it is key that we partner with the community. As Marie mentioned earlier, like there's a lot of issues that being building up over years, and we cannot expect those to go away overnight. It's gonna take continuous work. It's gonna take energy, but it's going to take true partnership, and that's how you build trust. And then it's also understand transparency is a key component of that, but also understanding that this is not a one-off thing, that we're not looking into doing vaccine and then we're leaving, or we're not looking into doing testing and leaving. We're really looking into establishing long-term relationships with the community so that we can improve the overall outcomes in general, not only during the pandemic, but beyond the pandemic. And how do we think about how we transform our healthcare delivery moving forward? We don't want to return to what it was before, because what it was before was not working for everyone. We want to use this opportunity to really enhance our care to do better for everyone, because everyone deserves it. And part of that is acknowledging and understanding some of the issues from the communities, from like concerns about getting the information on time, reliable information, but also having other concerns, for example, religious concerns, and partnering with people that they trust in the community, because we may have the science part, but perception is reality, and the community has different takes or perspectives or ideas about who they trust and also the information they're getting. So, for example, last week we were doing a Facebook Live with a priest from a Episcopal church in Chelsea, just to address the religious concerns about vaccination. And because we know that really there have been a lot of religious concerns in the community, particularly in the Latino community, but also African-American community, right? So all community about vaccination and everything. And we're not going to ignore that. We're going to address it, acknowledge it, and see if we can provide the best information together. And then our goal is to empower the community with the information, with the opportunity, with everything that we can give them, so we can all work together towards achieving a healthier future.
And what I see is there is a multi-level barriers that all of us need to like cross and try to eliminate. So you have people who are living under certain conditions, like overcrowded, as I was just explaining. But in addition to that, we have that people, for example, lack of transportation, lack of money. They are just not able to get them to a clinic vaccine, and they just don't know how. Or there are like some people that, for example, they just don't have the community connection, even though they are like from the community, and they just don't know how to get an appointment. And there are other people that probably experience are afraid because they lack of insurance or are under insurance, and they still thought that they're gonna be charged. There are other people, especially immigrant population, that especially those who are undocumented, that they probably don't want to give their personal information because they think that it's going to have other implications. So I think that all community messengers need to start like crossing those barriers, explaining in colloquial language, because if we start like talking and bringing scientific language, medical language, probably they will not be able to understand us. And the messaging is not going to be the same. So as Mary said, it is very important to be multicultural and to try to understand the specific needs that the community have in order to provide some solutions to the problems that they have. And what is important is that in addition that we are like informing the community, I think that we are like bringing that information back, in this case to the hospital, and saying, oh, this is the problems that we are identifying. When we are like talking to the community, here are some ideas what we can do to improve our messaging and how we can start incorporating different activities in order to educate them better and to help them get, in this case, vaccinated.
Dr. Sanchez, I think you said it well. There is no one size fits all to the questions and the work that we do, right? You know, we've come across, you know, barriers such as the tragic and dark events that still remain deeply rooted in the consciousness of the Black and other minority communities. And we have to listen to that too, right? We have to make sure that we hear their concerns, right? So I think it's, you know, it behooves us, like you said, to know that there isn't one size fit all, you know, other assurance, because, you know, they may be asking us, we might be asking them to set aside long held, cultural beliefs around holistic care and practice, so as community messengers, like Efren said, the community wants to see people that looks like them, right? That speaks their language, that's able to relate and sort of listen and understand the origins of their hesitation. And I have to say, some of this work is really just organic. We don't think about what we're going to walk into. We're just more ready to listen and answer their questions as best as we can, and try to help and educate them.
Thank you so much, everyone. You talked about, some barriers and challenges. We do have a question from the audience. Do you find that leading by example helps? For example, my entire family got vaccinated, sharing pictures of us, getting the shots on social media, etc. Do you find that those methods help at all?
Absolutely. Go ahead, Mary.
No, you can go. It's okay, Dr. Flores.
I'm gonna say, please call me Ephraim. So I'm gonna say absolutely. Absolutely, because we're definitely in it together. That's been a consistent message through and through the pandemic and moving forward. And the fact that the whole world is involved in this disease really shows how interconnected we are as human beings. And the more we show that, especially because there's a lot of concern about, safety, how quickly the vaccine has been developed, and side effects and everything. And I think that not only a healthcare worker, but even as who best ambassador from the community than the community itself, right? So the more you share this information, and people will feel more comfortable, right? So the best advertisement is word of mouth, for sure, for everything, right? So the way when you're hiring a handyman is the way that you're gonna think about, when you're trusting a service, when you're getting referrals to for a doctor, or getting referral for the vaccine, or who to trust, and the same thing that you always ask, and in sharing that we all in it together, that we trust the process, is very important, and a very strong message in the community itself, because then I have a solid footing to go into the community and say, did you get vaccinated? Because that comes up all the time. Or would you do it? Or would you tell your family? And my answer to all of those is yes, 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 and yes, right? So when I say, did I get vaccinated? I'll say yes. And then if they ask me, would you tell your parents to do it? I told them to do it. And even if one of my parents had COVID. And then the other thing is what vaccine, would you wait for a choice in the vaccine? And I said, the best vaccine is the first one that I get, whichever that one is. And that's always, I think by showing the example, it gives us a little bit more, not only solid footing, but it also is a stronger message that we're delivering in the community as well.
I think you said it well. I think I would probably just add, by protecting yourself and your family members from the virus, and getting the vaccine, you can begin to return to having some small gathering with vulnerable relatives as well, especially after everyone, and all are vaccinated. So there are some, bonus to, getting everyone vaccinated as well.
And then I think that it's important to highlight that our communities usually like to take decisions within their families. So if they are for example, in the hospital and they receive, I don't know, medical advice, I am sure that they are going back to their community. They're gonna talk to their family first. And probably if they are seeing an specialist, they're going to their local PCP or local provider and ask where to do that recommendation, to take that recommendation. No. So it's the same situation with the vaccine. It is very important because our community likes to share information, like to take decisions within groups, that we just share our concerns, share our experiences. And it's okay to say, hey, I got the vaccine and I feel I have these symptoms, because we need to build trust and we need to talk with the truth in order for people to be more calm, to receive better the vaccine. So we just share our experiences. say the good and bad, all the experiences that we have around, people will be more likely to take the decision and go and get vaccinated.
I'm also going to capitalize on that question in terms of family members. I think, this is the opportunity to throw a pitch out there too, to say we need more culturally diverse messengers like Efren, NG, others, and I to charge up and reassure our community at the grassroots level that we are not only just here for them, but family members are here too. So I think it's important, like Angie shared, that it modeling the way, family members are good to model the way for us as well.
I have to say, the power of storytelling, there's nothing like it. When we have stories and share anecdotes about family, friends, and everything, the message feels more genuine. It gets through better. And then people start opening up, sharing stories as well. And that, like when you said, it's an organic way, and things develop, and it becomes a really, really nice conversation while you're, getting the finger on the pulse on what's going on in the community as well.
I would definitely agree with you with Shuri's telling. I remember going to a Haitian church in Mattapan, myself and Dr. Matthias, and one of the questions one of the of the church asked was, her mother was 80 years old, she should get the vaccine. And immediately I shared, my mother's 83 years old. She became COVID positive several months ago. She has an appointment next week to get the vaccine. And the look on everyone's face was just so shocked, because I don't believe they were expecting me to share that story, and being able to share it in Haitian Creole was even more powerful. So I'm hoping when myself and Dr. Matthias, when we left, that story sort of had an impact for many of the community members to go and get vaccinated. So I do agree with Shuri's storytelling. It definitely delivers an impact.
Thank you so much. Moving on to the next topic, we have another question from the audience. Can any of you comment on challenges associated with community health outreach through virtual platforms?
That's a little difficult. I think for us, we've just been at the grassroots level, right? Because at the grassroots level, I guess we get to sort of like listen to people's concern. We get to have a true organic dialogue, and being able to share that personal connection, and I get it, right? With COVID, virtual is probably best, but, I think Efren shared, Facebook Live. I think that's a great outlet, or joining WhatsApp groups that are, not aware of the information and trying to share the correct information. But for me, I strongly embrace and appreciate the opportunity of being at the grassroots level in the community of the underserved.
And I think that there are like, sorry, Efren, there are like different levels. So for example, I am sure that we all at this point have given talks in Facebook or any digital platform to educate communities. However, I believe that the main barrier is giving the information to elderlies, just because they usually are the ones that don't understand how to use digital platforms, or how to use computers, or even, for example, if we talk about low-income population, probably they just don't even have access to internet. So it is very difficult, especially we start like talking about the Zoom platform that not everybody is familiar with. So I think that what it is important, if we want to continue doing some digital outreach, is to partner with community organizations, community leaders that can help us to spread the event, or just like the word, inviting people, because just us, like in this case, the three of us, it will be very, very difficult to reach every single people and to like share all the information that we probably want to give. So it doesn't matter that if it's within a digital platform or with an in-person event. I think what it is crucial is to have partners from the community community organizations, community leaders that are going to help us. But I agree with Mary, being in the community, understanding how they live, how they work, what their needs are, is gonna help us improve our messaging, and they receive better the information, just because the experience probably is different, because they see that they probably can see that we care, because we are like right there with them. And there are other ways. I mean, if you cannot go to the community because there are like different reasons, you can have options as a TV channels, like local TV shows, local radio shows that are also well known within these communities.
I would agree. I remember being on a radio station recently, and it was so powerful, the amount of questions that were asked, you know, so it does work, you know, anything works.
Oops, I wanted to add that. No, so I agree with what being said, and I would say digital outreach or technological, like advancing tech equity or tequity, right? It's a challenge moving forward. We know that telemedicine is here to stay, and the COVID pandemic has really put it in forward in an advancing telehealth and how we deliver care. But if we think about how already structural barriers that were existing and systems that have been built up on that, and we know that there are going to be already some intrinsic barriers already built in the system. So what I would always, and as we continue doing research or transforming our healthcare delivery, it's always important to take a moment of like a pause and say, like, what else can we do to tailor our approach? And in that process, then we have to engage the community, because we need to build trust, and we build trust by involving them in the process from the beginning. So how we tailor our technological platform, where it could be digital outreach, or is it going to be telehealth appointments, all of them. So what else, what are things that may be a concern, how we can address them in order for us to do better? And then once by integrating the community from inception to, you know, conceptualization to creating the new model, and the implementation is going to flow better, because they're already part of it, and they're already invested in it by participating in the process from the beginning. And they are going to help you address any ongoing issue of trust, for example, people may be concerned about getting registered, quote unquote, registered in the system, especially, you know, with immigration concerns, which have been shared from the community, but also, you know, should they trust the system? Is it the same as routine care? And those are things that we will be able to address better if we form these true partnerships that we are advocating for today, that we really need to not seeing that we're doing a service for the community, but it's really like how we work together with the community to enhance how we provide care in all aspects at MGH and the whole system in general.
You know, I just want to say that everyone can, you know, raise awareness about the vaccination and COVID-19 prevention in their own community, right? It's all about, you know, answering questions that, you know, everyone have, you know, is educating and informing, you know, our friends, our family members' friends. You know, if we all take the opportunity to sort of pause and just answer questions, it's going to be key in executing a successful, you know, vaccination movement. So I think all of us should be community messengers. All of us should be, you know, providers and answering questions that we are comfortable and have the knowledge to answer, because the entire community benefits when more people are vaccinated.
And then probably, sorry, Amy, to the if somebody's like wondering how to do it, I will say like the best way to start is just like by asking yourself the same questions. How will you respond to those questions if you were the one needing that information? Or for example, if you want to, I don't know, design a flyer or like go to a radio station, how will you become interested to read that flyer? What are you looking for? You as a member of the Hispanic community, Black community, Asian community, how will you, like, what are you looking for? And then once you are in other people's shoes, you can understand and can develop better that messaging.
Do you have tips for a staff member? For example, we have an audience member who is a healthcare worker, nurse leader, and a person of color. This person would like to volunteer in the community. What's the best way to be out there partnering with MGH to do this important work?
Anywhere, start anywhere and everywhere. No, but I mean, it's absolutely. I mean, I think that hearing that there are people in watching this this lunch hour webinar that are interested in getting involved, it just speaks of the power of like how we're in it together, and like, you know, how we feel like we're, you know, called to the duty of like, you know, doing more for our patient beyond the walls of the institution. So I would definitely, my suggestion would be to connect with the MGH Equity Office. Definitely Natalie Johnson, who's here joining us from the Equity Office, collaborate with SVP of the institution, Dr. Joe Betancourt, and they're also collaborating with a lot of NGB efforts. So I would say definitely through the institution, that would be the best way to do it, but also even just helping disseminate the message in your community with your neighbors or your church, or even the school. Like my kids go, you know, in the elementary school, and I was just chatting with some parents at a soccer game. They were like, you know, questioning about like, should they go vaccinate, when, where, and we were just chatting about like, you know, why do I feel safe and why we should do it. And even those interactions, it only takes one person, and if we do each other get one person in the right direction, is a very meaningful impact that we can all do together.
We have a question specifically about the Asian community. The Asian community is behind on vaccination as well. What are the reasons?
I think I think about, you know, as community messengers, right? And I think I shared this before. We need more community messengers. We need more people to be at the grassroots level, to listen to people's concerns. I know one of the emails I saw had an overwhelming outreach to have you know, healthcare providers to volunteer, you know, and it's specifically, you know, asked for the Asian community to sort of like step up and help support this, you know, movement, as it is very important. So I think as we continue to do more marketing around getting more community messengers that are from the Asian group, I think we'll definitely see some sort of shift as well.
And what I also think that is that we as a health providers need to do a better job reaching other communities that probably it is difficult if we don't have people that are culturally competent to reach different communities. So probably it's being more difficult to work with these other communities. And also within the Asian community, it is even more difficult because what we usually see in the demographics is that they group Asian as a whole group, but we just don't know if there are like South Asian, East Asian, and that are also culturally different. And it's making more difficult to develop probably messaging according to each group.
Just wanted to echo into like Angie's point in terms of like using the opportunity to tailor the messaging part, because it's easier to do like a blanket community, say Asian American, similar to Latin American, right? But there's like a lot of countries that form Latin America. But I would say the cultural differences in Latin America are not as marked as in different Asian communities. So you'll have Japanese American, you'll have Chinese American, you'll have Vietnamese American, and the cultural, like from language to culture, is very, very different. But it's up to us at healthcare institutions to take a deeper dive, connect with the community, and understand the messaging and what are some of the current barriers. There have been, unfortunately, like a lot of negative connotation associated with the virus, and you know, unfairly so to the community, and nobody has planned for a pandemic, or nobody wants bad outcome for anything, and just singling out a community has created also some, unfortunately, some hesitancy in it, on top of the already existing barriers that were impacting the community. So, you know, for me, it's, and my colleagues, is really like what we're doing, trying to take a deeper dive to better understand what are the differences, so we can inform our outreach efforts and improve our care delivery for different Asian communities.
Thank you. What are some out-of-the-box strategies to reach the less fortunate, for example, homeless, mentally ill in the community, particularly those not linked to any clinics or hospitals?
Oh, that's a great question. That's a great question. So I think it links with when we are out there, we don't know what we are going to get, right? We don't know if we are going to get someone that is homeless or someone that is, you know, that suffers mental illness. We just sort of, like I said earlier, there's no one size fit all. So I'm almost positive that we've, you know, communicated with, you know, members out in the community that does suffer mental illness, you know, and are, again, expressing fear and some paranoia against the vaccine. So we do our best in addressing, you know, their questions, and at least give them some comfort and answer what they are looking for.
And go ahead, Efren.
No, I was going to say, like, sorry, Angie, I want to say, like, you know, truly is like meeting patients where they are, right? So in terms of if they're trusting a healthcare provider in the mental health clinic, and you want to leverage that in the trusted setting from a trusted provider, or if we're talking about individual experiencing homelessness, and there's incredible efforts through the Boston for homeless healthcare program throughout the city. We have MGA has incredible collaborators in this space, and they're doing a lot of outreach efforts. But also, have you seen, like, you know, some of the individuals that may have some difficulty connecting with the healthcare system may have, it may be easier to get connected through a community health center, through a local church. And what we're seeing is that a lot of the testing and vaccination efforts are in collaboration with the community programs. We see vaccination, for example, like MGB have the community care vans that are doing testing and vaccinations in the community. They go out in the community in collaboration with the food bank. So for people that are having difficulty putting food on the table when they're coming in to get food, but also we can provide them with information, testing at the same time. And it's just really thinking about different ways of delivering care and truly meeting patients where they are.
Also, too, there are more of Efren, NG, and myself out there, because, for example, I know there was a community messenger that was out at a prison, right? So we are out there, right? So we are doing more work. We are doing great work. We just need more, right? We need more of you. We need more of us to sort of charge up, like I said earlier, to reassure our community that we are here for them.
I do want to include that there is an effort that's out there that's available. It's called Get Out There Vaccine Effort. It's, in short, it's GotVax, where they're going out to the community to vaccinate those who are homebound. And I will share that website with everyone in the chat box.
GotVax is actually a great you know, service. I've done some translation for them for the Haitian community as well. So there's so many opportunities out there to support the community.
Can anyone speak a little bit more about the Mass General Brigham mobile vans that are going out there to multiple communities?
Sure. I staffed that van, Reggie Lewis or Chelsea. That's just a really great opportunity to, again, answer questions, alleviate people's concern, hand out distribution kits. You know, in the kits are mask, hand sanitizer, information about COVID prevention and where to get vaccinated, sort of put people at ease to understand their the origins of their hesitation. It's a great opportunity. They usually have 2-3 hours, you know, blocks of time to volunteer and help support that movement.
Yes, and you are able within this opportunity to understand all the people's ideas about the vaccine and to answer those questions. So you have like a close interaction, person-to-person interaction, where you are like talking, educating participants, the community about the vaccine. You are actually even have the opportunity to help them get an appointment by giving specific the information. For example, in my case, I have been in Chelsea, and I can say, okay, for example, in Chelsea, I know that La Colaborativa, the Collaborative, which is a community organization there, they know they have a vaccine clinic. They are making appointments, so I have the opportunity to say, hey, do you know La Colaborativa? And most of people in Chelsea know this organization. So I can say, okay, you can go there, or you can call them, and they will make an appointment for you, or they even can give you the vaccine if it's during the vaccine clinic. So I think that the van is a very good opportunity to have this close interaction, to understand the community and to like provide the best information within these 3-4 hours time that you spend out there in the community.
Just wanted to add to that. Sorry, just wanted to briefly add that you know, there are two things about like you're going into the community. For example, like Amy, you made a great point about like the GovVax program, what is led by one of our own that in the EED here at MGH, Dr. Alistair Martin. They're doing an incredible job about going door to door, you know, thinking out of the box and meeting the community where they are. But also the importance about the community care van, similar to going door to door to the vaccination and answering questions and meeting people in the community, but also not only to provide the information, understand the concern, which is also gives us additional information on how we tailor our messaging, but also, you know, providing testing as well. It's just such a powerful statement that to go out there in the community and say, like, we're here to serve. We're here to meet you where you are. We're here to trying to understand. Angie mentioned it earlier about putting ourselves in the shoes, right? So it's like really providing care with empathy, and empathy is like putting ourselves in getting the patient perspective by going out there in the community, understanding where the need is. You know, like you were saying, Angie, like for me, very impressive just when I was like La Colaborativa in the community care van and seeing the food line, you know, 2-3 blocks, right? For like as long as going from MGH to basically going to Haymarket, if we put it straight. That to me is just a sign that it said like there's a lot of work that you know, that needs to be done, because the community in Chelsea being severely impacted just beyond, there is already existing need, and COVID has really exacerbated this need. So whatever we can do to bring out care, not expecting people to come within the 4 walls of our institution, but also like break those walls, break the barriers, and meeting them where they need, where it's more accessible, where it's easier for them, going to be not only it's going to be so rewarding and fulfilling for us, and it's the right way of doing things moving forward.
Yeah, I would definitely agree. I love being on the van. It's definitely an effective way to, like I said, ease worries about past inequities or negative experiences, you know, that members have had in the past. It's definitely it's a strong and a consistent presence. You know, one of the things that I know we found is that many people are scared about the side effects too, right? So they want to see a familiar face when they get the vaccine. A messenger, a community messenger that looks and talks like them is extremely influential. You know, I think as community messengers and everyone else, we can attest this is a matter of life and death for the community. So we are definitely honored and grateful to be a part of this important important work and would love everyone to sign on and be a part of this great work. So it's just great. It's definitely a great experience to be a part of this.
Thank you. So our hour is just about up. Before we close, any final thoughts you'd like to share with the audience?
I'd say that keep in mind that the best way to do it is to partner with our community. So yeah, we are called community messengers, but we need to go out there with the community. We need to find community leaders, community organizations that can help us, because we cannot do it just by ourselves. And we need more people to help us distribute information, not only in English, in Spanish, but different languages, different cultures, because it's the only way that we can help the people that are most in need.
The entire community benefits when more people are vaccinated.
Couldn't agree more. I think that in the way that when we engage in the work is definitely rewarding for all of us and for everyone that does it, but it also opens up our eyes to what else can we do in our system. So our care, how we deliver care becomes better, how we do research is better. So what my take home message more so just a call to action is just to get involved, because any assistance that you can provide to the community is better than what they're receiving before, which is not much. So any help definitely assist them, but also think of this becoming a true partnership that is bi-directional. So, and that you will get a lot of benefit from engaging in this type of work.
Great. Dr. Flores, Dr. Borgella, Dr. Sanchez, thank you so much for a wonderful discussion and all the wonderful work that you do. Special thank you to Natalie Johnson for working with us to coordinate this special discussion. And thank you so much all for joining us today. As mentioned, the recording will be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much. Have a lovely rest of the day.